Well, you may not know it, but May is Save Your Tooth Month. So if you're curious about tooth pain, dental care during this horrible COVID-19, I have Dr. Alan H. Glaskin, DDS, President of the American Association of Endodontists, for this podcast. Welcome, Alan.
Thank you very much, Mark. It's a pleasure to be here with you.
Well, you have some important guidelines on dental emergencies and oral health through the coronavirus pandemic. When should you contact an endodontist and healthy oral health practices during this time, do you think?
Well, let me state for your audience that most people don't even know what an endodontist does. They know orthodontists, move teeth with braces, but they're not familiar with the word endodontist. And endo is the Greek prefix for inside or within, and we go inside the tooth to clean out the infection that can be causing that terrible toothache that wakes you up out of a sound sleep at night. We clean out that inflammation that when you eat an ice cream cone and the cold is too cold for your tooth and your tooth aches for 20 minutes afterwards. We deal with infections that ultimately can wind up in the jaw and swell and distort your face. So we are the specialists in dentistry who save the natural teeth by being having the expertise to deal with the infections, clean them out, and hopefully save your tooth for a lifetime.
It's a lot of hard work in there, and very, very painful, I'm sure. I know I've been down that road, so I'm pretty sure.
Well, let me stop you right there. We are experts in pain control. The horrible stories you hear about root canals are cocktail stories, and you're going to get them, but you don't ever hear about the thousands of stories that patients have had completely painless visits. And so an endodontist is an expert in pain control. We are trained 2 and 3 years beyond dental school to provide that kind of a service. We use technology that is extremely high-end, like microscopes that can magnify the tooth 20 times when we're working down inside it. We use three-dimensional x-rays that can show us what exactly is going on and the nature of the problem, and we certainly are experts, as I said, in pain control. So no more horrible stories from endodontists, I promise you that.
Well, give us some oral health tips, if you would, Dr. Glaskin, while at home, wash your hands before and after brushing and flossing. Is that important there as well?
Yeah, we're recommending it in this time of COVID and in all times, because if you have the virus on your hands because you're an asymptomatic patient, and now I know your listeners are recognizing that people can have this virus and not have any symptoms whatsoever. You need to wash your hands before you brush your teeth. You need to then wash your hands after you brush your teeth. You need to change your toothbrush every 3 months to 4 months at the most, because those bristles tend to bend and wear out and get out of shape. If you can look at your toothbrush today and see it all brushed out of shape, you need a new toothbrush. And we recommend brushing first thing in the morning when you wake up and last thing in the evening when you go to bed, to disturb the bacterial colonies and plaque that is on your teeth and can do so much damage while you're sleeping, or if you eat your breakfast before brushing, the acids in that bacteria will absolutely work so much more effectively if you didn't brush your teeth before breakfast. So there are simple hygiene rules, and when you have your toothbrush out on the countertop, and most people have it in their bathroom, if it's a communal bathroom going to be used by your friends and others, you should put it away in a drawer and try and stand it up so it can drain. And those are my comments. Good oral hygiene.
No, well, I was going to ask you that one because that's a debatable one. You often hear, not that often, but when you do hear the conversation, it's a matter of, no, I like to leave it out because it airs and dries, and I do turn it, in a cup or in some sort of holder on the sink, versus putting the thing away. In what and where?
Well, that only putting it away if it's in a place where your guests or your neighbors or your friends would come. But it's better to get it to dry out, and then when your neighbors and your friends come over, just put it away then. If you need to leave it out so it can dry, leave it out so it can dry. No, I agree with you. That's the most important thing.
Let me ask you this, Dr. Gluskin, if I may. What are AAE's guidelines for handling a dental emergency during this COVID-19?
Well, we use the Center for Disease Control guidelines for protecting us and our patients from us. We use also the guidelines of the American Dental Association. Basically, the things we do, we're using the best masks available. We are covering ourselves up with gowns. Because we use microscopes, we're looking at the patient without having to get so close. And most importantly, endodontists 100% of the time use something called a rubber dam. A rubber dam can isolate the tooth, protect your mouth from any materials going into your mouth, and cover a little bit of your nose so your bacteria doesn't get on the dentist, and the dentist, even though they're covered, doesn't cause you any issues. So we use something that's very important to provide a clean environment in which to do our dentistry.
Let me ask you this question. Why is it important, do you think, to save your natural teeth?
Well, first of all, I'll appeal to your pocketbook. It's cost effective. If you're going to remove a tooth and then subsequently either restore it with bridge work or an implant, that is going to cost you far more dollars than it would be to spend the money to save your natural tooth and then go back to your general dentist so that they can restore it with a cap or a crown or an onlay. It is much more effective cost-wise to save your natural tooth. But in talking about cost effectiveness, it is very cost effective to go to an expert, all right? Someone who's had 2 to 3 more years of schooling and can absolutely do it correctly so that hopefully that tooth can last your lifetime.
Yeah, it's important. You know, when you're young, you mightn't think of that, but by gee, when you do get older, you'd wish you'd listened to that sort of advice a lot earlier. There's no doubt about that. Now, listeners, more information. There's a lot for you to read and follow up on, and go back over perhaps some of the things that Alan has talked about. Now, is this correct? This site? Do you want to give me that, Doctor? Please. It's long-winded, but
absolutely. The website that you can self-refer to an endodontist or check with your dentist that it's okay for you to go to the specialist, although it should be you can go to anyone you want, is findmyendodontist.com. And on that website, there'll be a site where you can put in your zip code and find a neighboring endodontist near you. Also, there are educational videos and other educational product on that website that you can link to that really show you what the process is all about. So it can take the fear out of your mind that you're going to have something unusual done. This is a safe procedure done painlessly.
That sounds good to me. And my guest is Alan H. Gluskin, DDS, President of the American Association of Endodontists. And if you didn't know what an endodontist was, now you do. And he's a professor and co-chair of the Department of Endodontics, Arthur A. Dugoni School. How do you pronounce that? Dugoni School of Dentistry?
Dugoni School of Dentistry, correct, in San Francisco.
Yes, the University of the Pacific in San Francisco. Some wonderful advice you've given us there, and a lot of courage during this COVID-19. It hasn't been easy for anybody, and your area is critical for personal health. I think more and more people are realizing that now, that, your teeth and that part of the head are so important to the rest of the body. So I thank you for taking the time out and sharing today with what you have done. And best thing for listeners to do is go to that website, www.findmyendodontist.com. Correct? Is that right, Ellen?
Find my endodontist, DONTIST.
Endodontist. Find my endodontist. Got it. All right. Well, keep up the good work. Thank you, Doctor, and thanks for taking the time out with us today.